My name is Heather Lubell. I am in general pediatrics outside of Philadelphia in the suburb of Yardley. I work for a larger healthcare system, but we work in a private suburban practice sort of outside of the system. So we function as a private practice. Impact has been really interesting throughout the whole thing, from the start, where we pretty much had to shut things down and revamp and figure out how to practice medicine in this new era, to now where we're getting a little used to the new normal, but knowing that we're going to have to shift weekly, potentially, depending on when we spike and what we're seeing in kids. Pediatrics has been a little insulated because the kids aren't the ones necessarily coming in looking sick, being hospitalized. So from the perspective of a pediatrician, as opposed to internal medicine, geriatrics, something like that, we are a little sheltered from the storm, so to speak. My practice has been able to keep up with checkups, and our goal is to make sure that our young kids stay immunized and stay healthy. We don't want kids to all of a sudden not be getting their standard shots. And then we have a pertussis outbreak or a measles outbreak on top of all of this. So keeping them healthy, keeping my staff safe, keeping my patients safe, is really the priority. At this point, we're all making sure that when we bring people in, we are doing it very, very cautiously. Nobody's sitting in our waiting rooms. We're bringing kids in staggered. We're not having well kids in the office at the same time as sick kids. So there's so many new things that we've had to learn and we do. Our area, because we're outside the city, is also a little bit different. I think Pennsylvania reacted, really well to all of this. I think Philadelphia did a pretty good job. We're in a suburb about a half hour outside of the city. And Bucks County did a really good job of this. They shut down the schools really quickly. They shut down businesses really quickly. And although the impact of that certainly is a whole different story, from a healthcare standpoint, our hospitals never got overrun. Our offices never got overrun. So that's been huge. I'm absolutely sure that in the weeks before we shut down, I saw colocations. In retrospect, there were people coming in with complaints that 100% fit the picture. I found out a week or two later after we shut down that some parents had been diagnosed of these kids that I had seen. So yes, but again, not directly, and certainly not since we've been really aware of all of this. And again, in pediatrics, it's been quite different. If we're hearing stories that the kids sounds like they potentially have COVID, for a while, we've actually been referring them. We're now in the process of trying to figure out how to test them in our office, how to keep our office safe while also tending to the needs of our patients. So that's been sort of my personal experience. I'm actually telling parents to practice at home. So I think it's really helpful especially to the younger kids, to get used to this idea that they have to be wearing this. So even if they're wearing it for a little bit here and there at home or when they're outside to play, getting used to it before they go back to school, reminding them to wash their hands really frequently. Kids are actually doing a much better job of it than I had thought they would. And I think when we as healthcare providers reinforce to them, thanking the young kids for wearing it and saying, hey, thank you for protecting me. Thank you for protecting your parents by wearing this. And reinforcing to them that it's not just for them. I think that makes a big difference. With the younger kids, I'm also telling parents to find masks that they think their kids will wear that they want to wear. So trying out for comfort. If your kid's a sports fan, get them Philadelphia Eagles face masks. Get them tennis face masks. Whatever it is, if your kid's a unicorn fan, get them unicorn, get them Disney, get them mermaids. Something that's going to be part of their style for the foreseeable future. And it sort of seems a little frivolous, but you'd be amazed at how much a 5-year-old is willing to wear a unicorn mask over a plain old blue surgical mask. And it can make a big difference. Hand sanitizers are tough, although it's getting easier and easier. Even online, Bath and Body Works and places like that, now we're up and running and have, hand sanitizer. So it's out there now. And I just make sure that people look for, the proper percentage of alcohol, as close to 70% or higher as you can get in hand sanitizer of alcohol. That's what you want to be looking for. In terms of masks, I mean, we're not looking for medical grade masks. We're just looking for good construction fit cloth. And it's amazing how if you go online, everywhere from the big box stores to Etsy, you can find masks now. And it's really, honestly, I think at this point, a matter of figuring out what is comfortable for your family to bring your kids to wear. We have baskets in my house at this point. I am not crafty. I have friends who are sewing their masks. That is not me. If you have that ability, I mean, that's all you need. But there's plenty of places online where you can find good quality masks that these kids can be bringing back to school with them. I'm looking for masks that my college kids can bring back to college and throw in the wash. That's not going to fall apart because it's going to be mandated on the college campus that they wear masks, as it should be. So making sure they have enough because they're going to lose them, they're going to mess them, they're going to need them for the foreseeable future. At the beginning, that was actually part of why we had to cut back so much. We couldn't get what we needed to keep our staff safe. We were being told to use a mask for a week and put it in a drawer in a bag to keep it safe. It's still not easy, I think, for people to get N95s and the higher grade medical supplies, but there's more of it. So we don't have a problem keeping my nurses and my front desk staff and my doctors safe. We have face shields, we have masks. So I think from a medical professional standpoint, right now we're good. I think from the community, I think masks are very effective. I mean, it's been shown time and time again that the more people wear masks, the less aerosolization, the less spread we're going to see. And if we could get that through to people, how important this is, I think we'd be doing a much better job. And I can't tell you how often I see that they think they're wearing it properly, but they're wearing it here. I'll remind them, no, it really has to be pulled up. I've even showed them how to keep it up, right? So they don't realize that they have to make it tighter. I've showed some of the kids how to wear it and how to wear it properly. So I think the more medical professionals that are reinforcing it with their patients, and hopefully the patients are then coming home and reinforcing it with their families, the better it's going to be. And the more of us who can teach our kids, hopefully they then reinforce it with each other. And people are getting used to it. I mean, it's going to be the new normal for a while. So like you said, people feel like they're suffocating, and I touch a lot of friends who say that. And I even, I go back to work on Monday mornings, and for the first hour, I want to touch my face, I want to scratch my nose, I want to take the mask off. And you reacclimate every week to it or every day to it. But again, knowing that it's going to be with us for a while, and that it's just really important to get through those uncomfortable feelings. At the beginning, when we were, back in March, trying to figure all this out, we used our Facebook page quite a bit to reach our patients. Not everybody was on there, but it was our first place that was easy to go. I could go on there and change it every day, and I could work on that. So we put our policies on there. It took us a while to get an email blast out, quite honestly, just because of the way our medical records are. We're not quite 2020, even though we're electronic. So we did finally get an email out. But we did use Facebook a lot. And then honestly, we used the phone. So we worked our lists, and any patients that we canceled because of early issues with COVID, we called them and made sure that we rescheduled them for checkups on the phone. I had my medical staff, and actually days when I was home, I was just working the list. I was going through kids with chronic issues that were due to come back, kids with medical or behavioral issues that we could potentially do telemedicine with. So we were literally just picking up the phone and calling our patients. We need a vaccine. I mean, that's the only thing that I can see at this point that's going to get us back to normal, whatever normal that may be at this point. But in terms of being out there and getting back to our normal economy and normal schooling and normal socializing, we need herd immunity. We need a vaccine. I think putting our money into figuring this bug out and figuring out why it's so virulent, how we can prevent it. And then the third thing, education, making sure that our country, that our people know how real this is and how important this is and how we can stop it and how it's everybody's individual duty to protect people around them.